Hello, and welcome to the first lesson on human movement sciences. The idea of this lesson will be somewhat short. It's introducing you to anatomic locations, planes of motions, as well as muscle actions. Throughout this course, you will be given items in which you should practice. You can practice on your own, writing things down. If you have any friends that are in the class, that would be a fun way of learning. So initially, we want to try to identify muscles as movers, defining those specific anatomical locations, explaining the types of muscle actions that the body can have, as well as identifying the planes of motion and the axes of rotation regarding those planes. So to start off, to really understand what anatomical position is, you will be able to best understand all of the different directional terms. So anatomical position, most widely used and accurate for all aspects of the body. All joints are considered to be in zero or neutral. No movement has yet occurred. The fundamental position, you notice how the hands are next to the body versus the anatomical where the palms are faced forward. When it comes to certain movements, that will help in understanding if you know the difference between the anatomical and the fundamental. When we're looking at specific terms, so first, two terms when the body is reclining. Supine will be face up, and prone is lying face down. Other directional terms, you can look at this map. So it's the spatial relationships between one anatomical structure and another. It's the road map on how you can describe one body part to another body part. The superior is up, inferior is down or below. You have medial, which is going towards this midline. Then you also have lateral, which is going away from the midline. Distal and proximal are two terms that are referenced when it comes to appendages. So the foot would be distal to the knee versus saying inferior or superior. And then you also have anterior, which is the front of the body, and posterior, which is the backside. These are where the activities begin. So when you see some of these terms and understanding, try to put them into a sentence. Our first assignment is exactly that, giving 5 sentences on the differences between the directional terms. So on this exercise is understanding the difference between anterior and posterior. And then superficial and deep. So those are two toward the surface of the body, and deep is away from the surface of the body. When we are thinking of the curvature in the spine, there are alignment variation terminologies that you should be a little bit familiar with. So on this top image, we have normal, then we have kyphosis, which is an increased curving of the spine outward or backward to the sagittal plane. We'll get into plane soon, don't worry. The second is more of an exaggerated lumbar curve. Then you also have the lateral curving, which is called scoliosis. So in general, in speaking on planes of motion and axes of rotation, so human movement takes place through a plane, around or about an axis perpendicular to the plane. Say that in your head. Take a snapshot. When you look at this image, this is what that means. So human movement takes place through a plane, out and around an axis perpendicular to the plane. So these blue pieces of glass, we'll say, would be the planes. So the place that human movement occurs, starting from the anatomical, notice his palms are facing forward. Really, it's an imaginary two-dimensional surface through which a limb or body segment is moved through. It is a flat area. It doesn't necessarily have to bisect the body. It would be similar as if you were leaning on a wall and you could do somewhat snow angels along the wall. That plane can actually be behind you, but you're still following that two-dimensional imaginary surface. So within those planes, that motion actually through a plane revolves around a specific axis. There is a 90-degree relationship between that plane of motion and its axes. So kind of like if you took a piece of paper, you put a pencil directly through it, and you could actually rotate that piece of paper around that pencil. That would be what an example of perpendicular 90 degrees. That piece of paper would be that plane, that pencil would be the axes. So that axis, it's a straight line that an object rotates around, just like I explained. When we're thinking of the body specifically, so joints move or turn around and turn about an axis that has a 90-degree relationship to the plane. In the human body, the joints are the axes. The bones are the objects rotating. So to go a little bit more specific when we are speaking on the three different planes. So first we have the sagittal plane, which is actually the middle image. So in that middle image, it's a plane that bisects the body from right and left sides. It occurs around the coronal axis, and all movements of flexion and extension follow that plane of motion. The frontal plane, the first image, bisects the body into front and back halves, or anterior and posterior. It occurs around the anterior-posterior axis. Notice the resemblance in those terms. The movements of the body in that plane would be abduction and adduction. The transverse plane, the last plane of movement, is where rotational movements start. So the axis is called the vertical axis, and internal, external rotation, circumduction, movements that are circular or rotating in nature follow along that transverse plane. So other terms, other things to remember when it comes to movements in the joint. So terms are used to describe actual change in position of the bones relative to each other. So when the angles between the bones change, movement occurs between the articular surfaces of the joint. So when two bones are connected, that's the articular surface. Whenever those two bones, say from the elbow would be the joint, the lower arm versus the upper arm, those would be the two articular surfaces that would be responding to whatever joint movement, be it flexion, extension, etc. Now, additionally, prefixes may be combined with other terms to emphasize, say, excessive motion, like hyperextension. The basic terms, similar to how we described when we were looking at the planes, we have flexion, extension, abduction, adduction, and rotation. Those are the main terms of most movements. Now, some of the ancillary movements we're going to go through a little bit, actually in a couple slides. So when we're looking, this is a frame of reference. At all times, when we are moving in flexion and extension, we are in the sagittal plane. When we are doing abduction away from the body and adduction, bringing, say, the arms closer to the body, that is in the frontal plane. And then the rotation, again, is in that transverse plane. And the non-fundamental movements. Take a moment, read through these. You can pause the slide. You can also go look on, there's probably hundreds and thousands of different Google videos if you want to go look on YouTube so that you can watch an individual go through these ranges of motion just to get a reference. Now, major joint motions and their planes of motion, as well as their joint movements. This is another reference slide that I've pulled off of a textbook, so that you can kind of get an idea that there's a lot of movements per joint. They do move in multiple planes. There's also some joints that only move in one plane. Again, pause the video, kind of look through it. Now, in speaking of movement, no longer in anatomical terms, but this is more for dynamic motion. So muscles as movers. We have agonists and antagonists. Agonists are those prime movers. They are the main muscle responsible for the movement that you are producing in that joint. So when we are thinking of a bench press, the main prime agonist would be the chest muscles, the pecs, as well as the pec minor. Now, the antagonist of the bench press, the opposite action of the prime mover. As an example in this one talks about the leg extension. The hamstrings are the antagonist to the quadriceps, which are the prime mover during a leg extension. So going back to that bench press, the antagonist for the bench press would be anything that would allow the arms to come back and away rather than pushing the bar forward. So more muscles on the posterior aspect, the absolute opposite of the pec muscles that are on the anterior aspect of the body. If any of this confuses you, take a pause. You can find some of this information within the ACE textbook, but a lot of this is in extraneous textbooks that we've accumulated over the years, of course. Then, in addition to the antagonist and the agonist, the prime mover, we have the synergists and we have the stabilizers. So synergists are the muscles that assist the prime movers. So an example, the hamstrings act as a synergist to the glutes during a squat. So technically, during a squat, the glutes are the agonist, the hamstrings are the synergists. So if that's the case, those muscles are on the posterior aspect. If we're thinking in terms of antagonist, typically the quadriceps are an antagonist of the squat. And then stabilizer to follow that up. Stabilizers are just what they sound like. The deep muscles of the back stabilizing the low back, pelvis, and hips during the squat. These are those extra muscles that keep the body into a position in which we can complete a movement. This table is a little blurry, but when you're looking, it kind of gives you some examples of those muscles, of the exercises, for the muscles that were used or the questions that I asked a couple slides ago. That way you can kind of test your answers. Now, again, if you would like to practice, go ahead and check out this website, exrx.net, and go through some of these exercises and find the agonist, the antagonist, the synergist, stabilizers, etc. So going over the muscle actions, we have 3 muscle actions that occur within skeletal muscle. We have an isometric contraction, we have an eccentric contraction, and we have a concentric contraction. We will go through each one separately on the following slides. So just to see the image, we have isometric on the left, concentric. Notice the arrows when it says movement. This one's no movement for isometric. Eccentric is the lengthening, and concentric is the shortening. Looking through these, take a moment, pause the video. You can even utilize the slides that are present in the chapter so that you can practice the muscle groups and decide what the agonist is doing depending on the phase of the movement. Same idea for the concentric, same exercises, and then again for the isometric. So on the isometric, let's think about it. So with the bench press, when is the agonist acting isometrically? So if the agonist, as we determined earlier, are the pecs, possibly the anterior deltoid, maybe pec minor, when we are fully extended and that bar is reaching to the ceiling and we pause, that would be the moment in which the bench press would be isometric. And finally, there's some other activities, there's other exercises that you can find on the internet and really be able to practice. So figure out when the agonist is activated concentrically, isometrically, and eccentrically. All 3 muscle contractions are typically present when we are doing weight training. That might change when we're doing something like a plank, where typically it's always isometric. I hope you enjoyed the presentation. If you do have any questions, please let me know. And I apologize about the delay in this video. I didn't realize I was having errors with it.